So, looking through this stack of clinical research today, there's this really recurring theme about just the sheer frustration of metabolic slowdown.
Right. It's something so many people deal with.
Exactly. I mean, especially for a lot of women between 35 and 60, standard diets just stop working once those hormonal changes kick in.
Yeah, it can be incredibly defeating for them.
So, for this episode, we're focusing on what the actual medical guidelines say about using GLP-1 medications to address that. Drugs like Ozempic, Wegovy, and Zepbound.
I'm really glad we're looking at this specific research, actually. Wait, how exactly did these shift from being diabetes treatments to mainstream weight loss?
Well, it basically traces back to a better biological understanding of why you regain weight after losing
Oh,
it.
that makes a lot of sense. So it's about the biology of weight regain.
Yeah, that biological reality is key here. The clinical data shows that when you try to lose weight just through caloric restriction, your body literally fights your efforts.
Wow. Wait, how does it fight back?
Well, your hunger hormone, ghrelin, spikes dramatically, and at the exact same time, your resting metabolic rate plummets to preserve energy.
So the body basically goes into survival mode. That reminds me of like thermostat in your house.
Oh, that's a really good way to look at it.
Right, like automatically cranking up the heat because it senses a window is open, just aggressively trying to force the environment back to its baseline.
Yes, that thermostat analogy perfectly captures the metabolic resistance we see in the data. So to bypass that resistance, GLP-1 medications mimic a natural digestive hormone.
Wait, explain that mechanism a bit more. Like, how does mimicking that hormone actually stop the thermostat from fighting back?
It essentially works on two fronts. It targets the brain to cut appetite signals, and it physically slows down the stomach's emptying mechanism.
Okay, that is fascinating.
Yeah, and the clinical trials show that the active ingredient, semaglutide, drives about a 15% average weight reduction this way.
That 15% is significant. But the data on tirzepatide shows an even higher drop, right? Like over 20%.
Exactly, you caught that crucial distinction.
Yeah, I noticed in the reports that achieves this by targeting two hormone receptors, GLP-1 and GIP, rather than just one.
Right, which explains why we see such varying degrees of efficacy across different patient groups.
But despite those high numbers, the medical criteria for getting these prescriptions are quite strict, aren't they?
They are, yeah. The guidelines state you generally qualify with a BMI of 30 or higher, or 27 if you have a weight-related condition like hypertension or sleep apnea.
But relying on BMI seems surprisingly outdated to me, especially since the research highlights how it can't differentiate between muscle mass and visceral fat.
I had the exact same thought when reading the guidelines, which is why the literature emphasizes that physicians are instructed to use BMI merely as a starting baseline.
Ah, okay, that makes more sense.
Yeah, they actually heavily evaluate your overall metabolic health and previous weight loss history before prescribing anything.
So stepping back for a second, what this really means is that major organizations like the WHO and NIH are now medically classifying obesity as a chronic metabolic disease.
Right, exactly.
It's not just, a lack of discipline or willpower.
And acknowledging it as a chronic disease dictates a much longer, more realistic timeline for treatment. The studies indicate that meaningful, stable results take about 6 to 12 months to fully develop.
That timeline makes sense biologically, but the adjustment phase sounds incredibly challenging from what I read.
Oh, absolutely. Because the drug physically slows stomach emptying, as we talked about, patients frequently report early side effects like severe nausea and fatigue.
That might explain something I've been noticing in patient case studies. People really seem to struggle during that initial adjustment phase.
Yes, and those gastric side effects are exactly why lifestyle factors like sleep, stress management, and specific nutritional pacing remain critical.
Right, you can't just take the medication and ignore your diet.
No, not at all. Or the nausea just becomes completely unmanageable.
Interestingly, several case studies we reviewed referenced specific physician-guided GLP-1 programs that people have been trying, like to get that comprehensive support.
Yeah, that kept coming up. Patients are increasingly choosing medically supervised programs that combine the medication with nutritional coaching and clinical oversight.
Right, moving away from just relying on a standalone prescription. By the way, if you want to learn more about the physician-guided program mentioned in the research, you can find a link in the description.
It's definitely an option worth exploring if you've been stuck in that frustrating cycle of metabolic slowdown we discussed at the beginning.
For sure.
Which leaves us with a final thought to ponder as we wrap up this episode. If science now proves that weight regulation is largely a biological condition rather than just a matter of discipline, how might that fundamentally change the way you view your own past weight loss attempts?